Yes, so in continuing from the previous video, now we go to the feed point. The patient is responsible for obtaining all necessary information which have a bearing on his or her management and treatment, including all financial implications. Let me take it again. The patient is responsible for obtaining all necessary information which have a bearing on his or her management and treatment, including all financial implications. Remember, yesterday I said that you have the right to know everything about your condition, the treatment, investigations, prognosis, possible risk concerning procedures. It is your body, and the doctor is going to help you take care of it. So you have the right to know everything about it. Okay, and so in knowing all of these things, it may come with some financial cost. You have the right to know that, oh doctor, please, how much will this procedure cost? How much will this cost? So if we put it together, how much will it cost? If we do not ask, it wouldn't be how should I say it? In fact, we need to ask, because definitely we need to know whatever amount will be involved in whatever procedure is going to be carried out for us, so that you prepare adequately. But let me say you do not ask, and then you come and we need this equipment to be able to take care of you, and you probably didn't ask how much it will cost. Maybe we sell it in the hospital. You probably didn't ask how much it would cost, and you come. How are you going to be able to afford that particular item we need in helping with your treatment? Okay, so it's your responsibility to obtain all necessary information which have a bearing on your management and treatment, including all financial implications. So you're supposed to know that how much will the surgery cost, then you prepare, then you come. How much is this item? You prepare, you come. You know, yes, so basically you're supposed to take charge of your healthcare, and it's in helping you to take charge. That's why I explained the patient's right to you yesterday, for you to know that you have the right to ask. So if you go asking for the cost of this, how much everything will be, no, I will tell you that please don't ask us to, to do all this calculation, or no one will give you attitude. Okay, it's something you are supposed to know, and it's something you have the right to know. Okay, this is very, very, very important. Very, very important. Okay, thank you. So let's go to the seed point. As the patient is responsible for acquiring knowledge on preventive, promotive, and simple curative practices when necessary to seeking early professional help. I hope you've heard this. Oh, Ghanaians, my Ghanaian people, my fellow Ghanaians, I hope you have heard this. The patient is responsible for acquiring knowledge on preventive, promotive, and simple curative practices, and when necessary, to seeking early professional help. This is the major reason. In fact, should I say yes? It's the major reason why I set up this channel, to be able to share some of these health tips. Okay, so besides sharing this right and responsibility for you to know about it, for sharing preventive health tips, and for you to know about conditions, and know that you need to check your blood pressure to avoid you becoming hypertensive, from developing hypertensive heart diseases and its other complications. For you to know that you need to check your weight to prevent obesity, which will in turn lead to hypertension. Hypertension in turn will lead to kidney problems. For you to know that when you begin to see flashes of light, although you're in a dark place, yet you begin to see flashes of light. There is no light in the room, but you are seeing light. From where? Or you begin to see that you see certain strands of cobwebs, or you try to touch them and you can't touch them. You know that these two in combination, are probable signs that you may have retinal detachment. In fact, yes, that you may have retinal detachment. And so you need to go and see your doctor today. As at the time you are hearing this, you begin to prepare yourself. The account will tell you that doctor. Okay, so it's basically like you watching this video, Yes, it is so good you are watching it. But according to the patient charter, it's like it's your responsibility to know the preventive measures concerning conditions. So if you chanced upon this video, thank you so much for chancing upon my video. Yes. But then it is also your responsibility to know about what I'm talking about now and to know about whatever it is I talk about on this channel, the preventive measures. Okay, to know about, yes, basically what I've spoken about, to know they're supposed to eat a well-balanced diet that contains less salt, less saturated and trans fat, and less sugar. I hope you know this. Anyway, about the diet, anyway, let me keep that. We'll be talking about more interesting things about diet very soon on this channel. So I hope you get what I mean. So it's your responsibility, it's our responsibility. Because I'm also a potential patient. Every individual, in my opinion, yes, let me put it this way. In my opinion, every individual is a potential patient. By potential, I mean anything could happen to you. It could be that, you may have let me say you may have allergic rhinitis. You may come to the hospital for stuff like cetirizine. You are a patient in that regard. So you'll be like, something similar to common cold. Does that make me a patient? You are a patient. Okay, so in my opinion, every individual is a potential patient. Yes. So it's my responsibility to know preventive practices. Preventive measures when it comes to healthcare. Okay, proper hand washing and all of that. Now the 7th point, there is patients responsible for maintaining safe and hygienic environments in order to promote good health. The patient responsible for maintaining safe and hygienic environments in order to promote good health. This is self-explanatory. The 8th point, the patient is responsible for respecting the rights of other patients, clients, and health service personnel. Good. This is also very important. The patient is responsible for respecting the rights of other patients, clients, and health service personnel. So I think if I remember correctly, the professor that taught us this last year mentioned that you can't say, you have the right as a patient to do as you wish. So you're on admission with other patients, yet in listening to your radio, you remove the earpiece from the radio, from your phone's radio, and you're playing the music aloud in the in the ward. Or even if it is the traditional radio, the typical Ghanaian traditional radio, you put it on, set your antenna, and then, making so much, disturbing everybody. The fact that you're listening to something doesn't mean the other person also wants to listen to it. Okay, so if you're listening to, whether it is this is Wine's song, Goodness, is it Goodness of God, or I've forgotten the title. Or it is Diana Hamilton's Wasem. It's not everyone that wants to listen to that Wasem at that moment. So please put in the earpiece and listen to your song. Okay, so this is just an example I'm giving that it is your responsibility as a patient, it's my responsibility as a patient to respect the rights of other patients. Okay. Yeah, and also to respect the rights of other patients or clients and health service personnel. So we know you have the rights, all the rights you spoke about yesterday. You have all the rights. But it doesn't mean you wouldn't respect the health service provider or the health care personnel on the ward. The nurses, the doctors, the lab technicians, the radiologists, the cleaners, the security man, any health worker, as far as the person is in the hospital over there. In as much as you respect, you like your rights, okay, that's the same way this individual also has his or her rights. So you can't say you have your rights and so you disrespect the other individual. So as you are enjoying your rights, please make sure you are respecting the rights of this health service personnel too. Okay, so we need to be as polite as we can to the health service personnel on the ward. Anyone that works in the hospital, we need to respect them as patients, because everyone is doing their part to ensure that at the end of the day we are well taken care of. Okay, so the nurses, the doctors, yes, and like I said, in my opinion, the security men, the cleaners are all inclusive. Everyone that is involved in your care has to be respected. In my care, has to be respected. Okay, good. Now to the very last point, which is point 9. protecting, the patient is responsible for protecting the property of the health facility. Remember yesterday I said you have the right to feel safe in the health facility, right? That's the same way we have the responsibility to protect the property of the health facility. So if it is the should I say the wardrobe that you've been given, please let's take care of it. Okay, when we have been discharged, let's make sure we remove the rubbish, the leftovers from it, and put it in the bin. We are not supposed to leave the waste stuffs in the wardrobe, and then some of them will stay there, get rotten, and the whole room will smell so bad. Okay, so let's take proper care of hospital facilities. Stuff like the cardiac table too. Let's take care of them. Okay, the washroom, once we visit the place, let's flush it properly, So long and short, as we are enjoying the security of the health facility, let's take care of the health facility too. Okay, so this brings us to the end of the patient's responsibility. I hope you enjoyed the session. If you have any question, please put it in the comment section. I'll answer appropriately. If it's something that requires more explanation, deeper than what we have been taught or than what I know, I will ask my consultants, I will ask the professors who teach us for them to explain it more. I'll ask them, the question you sent me, I'll send it to them, ask them about it. They explain to me and I come and deliver to you. Okay, thank you so much. The other day when I said something like that, someone was like, I said this and then one guy made a certain facial expression. I was like, I don't see what is wrong. I don't see what is wrong with me going to ask for more information from the professor or consultant when the question is deeper than we have been taught. I just don't see anything wrong with this. And I don't see anything wrong with admitting it. If I do not admit it, where else is the information going to come from? I mean, where else is all this information come from, if not from our authorities? Okay, so it's definitely coming from them. So it is no news or no secret that if the question is deeper than we have been taught, or if the question is more technical, these rights and responsibility things are more technical and they are more legal. So there will be more legal steps to it. So if it's deeper and more technical and more legal, I mean those kind of legal stuff, I don't see why I should come and sit here and formulate my own opinion when there are professors and consultants that I could go consult. Okay, so thank you so much for listening to me. Thank you so much, yes, for watching my video, and thank you for staying with me. I will see you in subsequent videos. Do have a nice day. Continue to have a pleasant day, and I'll see you, God willing, tomorrow. Have a nice day. Bye.